Thank you. Thank you. First of all, thank you for the opportunity to speak here. I was treating patients earlier this morning, and if I'm not here, it's because I'm treating patients, so my apologies. Anyways, it seems like everyone's really passionate about their topics. I'm very passionate about auricular acupuncture, specifically for substance use disorders. I have a practice in Mesa, doctor of acupuncture, also masters of psychology, masters of kinesiology. Okay, so here are some of my publications, and I'm going to provide an overview of acupuncture. We're going to operationally define what acupuncture is. We'll talk about research and innervations of the ears and why the is helpful. We're going to operationally define substance use disorders, and we're going to discuss the benefits of auricular acupuncture for SUDS. I have a very robust slide deck, so I might actually go ahead and skip through some, but if anyone wants the slides, let me know. So anyways, overview of auricular acupuncture. Let me see, my Zoom screen bar is right in the way, so let's move that. So TCM has traditional Chinese medicine. Auricular acupuncture has its roots in TCM, dating back thousands of years, where the ear was viewed as an important energy pathway connected to all major organs. And in the 1950s, there was a modern development by Dr. Paul Nogier, a French physician. He developed the modern system of auriculotherapy, proposing that the ear resembles an inverted fetus with specific ear points corresponding to specific body parts. Okay. And so the operational definition of auricular acupuncture is a therapeutic procedure in which specific points on the external ear are stimulated, typically using fine sterile needles, pressure beads, or electrical impulses to produce physiological or psychological effects that correspond to specific regions or functions of the body. So here we've got external ear anatomy right next to the fetus so that you can see at the lobule sits the head, and then all up through the helix would be the spine. The antihelix is very much used for spine. You have the scapha in there, and the triangular fossa is a good one for hips and so forth. So you know, I won't go through all of it because we're not actually teaching, but you can see the proposal and how the baby sits, and the different anatomy of the ear. And what's interesting about auricular, what interests me a lot, is where you've got the conchas, and those are the deepest part of the ears and the hardest part to access. And that's where all the organs, the representations of the organs sit. And I'll show you here. So like if somebody has lumbago, you could arguably use the ear as supplementary treatment for acupuncture to treat lumbago. And then here you've got Sima concha, cavum concha, and you'll see inside of here, like you could treat a lot of organs. And I'll get into, it's not a standalone treatment for organ, but I am focusing on substance use disorders and more mental health for this presentation. But right now I'm just focusing on, you know, the French's work about auricular and the representation of the body and it being a microsystem. All right, so nada. We're going to focus on nada for this presentation. 5 nada points are situated in areas of the ear that receive innervation from the vagus and or trigeminal nerves. So there's some anatomy. Stimulating these regions activates various centers within the brain. Research using laboratory experiments and fMRI studies in both humans and animals has helped clarify how ear acupuncture influences the autonomic nervous system, the limbic system, which governs emotion, memory, and sexual function, and the HPA axis, which was talked about earlier. And there's your reference. The HPA axis connects the brain with the adrenal gland and thereby controls reactions to stress as well as many physiological functions. We'll go to the next slide. Okay, so this book, I actually had the pleasure of meeting the author of this book, Kaja Landgren, at Society for Acupuncture Research Conference. So I have the permission of her to utilize this, and there's the reference. So as you can see, the ear is innervated by several partially overlapping nerves. Concha innervated by a branch of the vagus nerve, and in this visual on the left, the area is striated with horizontal lines. Now, the upper part of the ear is innervated by a branch of the trigeminal nerve. the triplet nerve, which is marked by the vertical lines. In the checked area, the trigeminal nerve and the vagus nerve overlap. And then the lobe and the back of the ear, the area with skewed lines in the picture, are innervated by the large auricular nerve and the small occipital nerve. Both of these two nerves are parts of the cervical plexus. So we discovered some innervation. So just a summary here. I'm not going to read all of this. It's just a nice summary for time's sake. I want to get into NADA here. There is a specific acupuncture protocol that has been successfully used since the mid-1970s to treat those in recovery, referred to as the NADA protocol. Michael Smith, a medical doctor at Lincoln Hospital in the South Bronx, New York, developed a simple technique for the treatment of substance use disorders. The NADA protocol is not standalone. It works best when used in combination with comprehensive treatment program that offers other elements such as counseling, education, family involvement, peer community support groups, supportive medical health care, essentially the biopsychosocial model, right? Both ears are needled and retained for 30 to 45 minutes. And of course, it can be customized and decreased for first timers. So here's the actual protocol. And this comes from actually the NADA official website. And the first point is sympathetic, which calms the nervous system down and helps with overall relaxation. And we discussed the anatomy and the innervations and why that is. The next point is going to be in the triangular fossa. It's referred to as ear shen men, or spirit gate, reduces anxiety and nervousness. The next point represents the kidney, just inside the Simba concha there, for calming fears and healing internal organs. The next point is liver, and that helps with detoxification, blood purification, and to quell aggression. And then you have here the fifth point in the cavum concha, the lung, promotes aeration and helps clients let go of grief. Per NADA, National Acupuncture Detoxification Association, AcuDetox, also known as acupuncture detoxification, is a form of acupuncture used to help people detoxify from substances like drugs, alcohol, or stress. It involves inserting fine needles into specific points on the ear, which referred to as broadly auricular acupuncture, which are believed to help to balance the body's energy and stimulate the healing process. And here are some more reasons why detox and acupuncture can be helpful for your population. Well, I'll get into the help, but I want to also operationally define substance use disorder. So it's a chronic relapsing condition characterized by the compulsive use of a substance despite harmful consequences. It involves cognitive, behavioral, and physiological symptoms indicating that an individual continues using substances even though it causes significant problems in daily life. And according to the DSM-5 TR, which is the latest diagnostic tool in mental health in the US currently, SUDS occur when the recurrent use of alcohol or other drugs lead to clinically significant impairment or distress. And here's some common substances involved: depressants, stimulants, opioids, hallucinogens, cannabis, inhalants. And of course, this list is not all inclusive, but just a variety. All right, so benefits: it helps to reduce cravings and withdrawal symptoms. It supports detoxification, promotes relaxation and reduces stress, prevents relapse, improves sleep, improves mental and emotional health, boosts overall health and well-being, enhances mind-body connection, and supports a holistic recovery approach. And for time, well, I guess we have time. I zip through those. This is the last part of the slides. I can review some of these on the higher level. So reducing craving and withdrawal symptoms. So it works by stimulating certain points in the body that are believed to balance the nervous system and reduce physical and emotional symptoms of withdrawal. It can make it easier for individuals to stay on track with recovery. So supporting detox, obviously, putting needles in people's ears will not detoxify them alone. They do need, the banana bag, the vitamins, the nutrition, and also just, a medical detox center. But a lot of times, rehabilitation centers will offer NADA as adjunctive care, or they'll have acupuncturists on staff to support the detox process. So basically, acupuncture can assist in detoxifying the body by stimulating specific points and enhance the body's natural ability to remove toxins. Um, Okay, promoting relaxation and reducing stress. So recovery from addiction is an incredibly stressful process. Acupuncture helps activate the parasympathetic rest and digestive system, inducing relaxation, reducing stress, and calming the mind. This can be especially important for people in early recovery, as stress can be a major trigger for relapse, especially because a lot of detoxification centers are inpatient unless people have, very much monetary funds and means to have somebody come to their house to detoxify them. But by and large, people are going to go somewhere to detox. So they're out of their element. They're not staying necessarily with their biological family. And so acupuncture and auricular acupuncture, not a protocol, can help put them in that rest and digest stage. Preventing relapse. By helping manage stress, anxiety, cravings, and emotional instability, acupuncture can play a role in reducing the risk of relapse. It can support overall well-being, which can strengthen an individual's resolve to maintain their recovery and stay committed to a healthy, sober lifestyle. It can improve sleep. And so many people in recovery struggle with insomnia or disrupted sleep patterns because of the neurochemical changes that drugs make on the brain. Now the brain doesn't have them anymore, so it takes time for that brain to recover. So acupuncture can help improve quality of sleep by calming the nervous system. All right, improving mental and emotional health. So this is starting to, become repetitive. So I will go over the endorphins. So the release of endorphins and other neurotransmitters during acupuncture can improve overall well-being. So it's not, recovery is not just physical, it's a biopsychosocial condition where it affects the biology of the body, it affects the psyche of the mind, the psychology, and it affects socializing. Oftentimes people lose jobs, families, friends, loved ones, and so forth. So it involves healing emotionally and mentally. And acupuncture is thought to help regulate mood and alleviate symptoms of depression, anxiety, emotional instability. And those sometimes come in hand, if not temporarily during the acute detox phase, but sometimes there are, co-occurring disorders that can happen. So it boosts overall health and well-being. Um, so here's some physiological things that it can do. It can help boost circulation. It can help strengthen the immune system and promote overall wellness. The NADA protocol includes the lung corresponding microsystem point in the ear, and in acupuncture, the lung meridian, not the lung organ, but the lung meridian represents a concept called Wei Qi, or the defensive Qi. And that's, we want to promote the Wei Qi. We want to promote circulation. We want to promote the immune system and overall wellness. Enhancing mind-body connection, which other professionals today have discussed. Recovery is a journey that involves reconnecting with one's self and one's body, and acupuncture encourages mindfulness. It can help individuals in recovery develop a deeper awareness of their body, emotions, and triggers. This improved connection can make it easier for individuals to navigate challenges in recovery. Oftentimes people in recovery feel like they say, like, we're coming out of our skin, or we feel like a foreigner in our own body. And so the NADA protocol helps them become mindful and grounded. And it supports a more holistic approach. So while they're doing the sleep medications, they're doing the banana bags, they're doing the nutrition, they're doing, all of the counseling and the family therapy, acupuncture and NADA protocol is another aspect, addressing physical, emotional, and spiritual aspects of recovery. And I want to point out, like, the root word of spiritual is spirit. So a lot of times we'll ask people who are on the NADA protocol, like, how is your spirit? Not just how are you, because, oh, I'm fine, right? So how is your spirit? How are you doing in the totality of things? And so just to sum up, acupuncture is beneficial for people in recovery. It helps reduce cravings and withdrawal symptoms. It promotes relaxation. It lowers stress. It can improve mental health by alleviating anxiety and depression. It can enhance sleep quality, support detoxification, boosting overall health, strengthening the mind-body connection. It can reduce risk of relapse. As part of a holistic recovery plan, acupuncture supports both physical and emotional healing, making it a valuable complementary treatment in recovery. So I have a little practice in Mesa, but I also go into detox centers and rehabilitation, and I provide this NADA protocol for those who are interested. And, like in summary, we discussed the innervations and we discussed the microsystems. And then these are the 5 points of data. And I have my references. I have a little bit about me and places that I teach as an adjunct faculty. I teach neuropsychology, research methods, intro to psychology, and anatomy and physiology, and ethics at a number of colleges, universities, and so forth. And I'm always looking for to advance that in this economic time. If anyone needs an adjunct remote faculty in anatomy and physiology in a variety of courses in psychology, very passionate instructor, in what it is that I do. Oh, and so with that, I will stop sharing